Hello, hello, hello. Welcome. I am Dr. Joanne Michelle Martin, and I am here getting ready to talk to you guys for Black Maternal Health Week about monitoring during pregnancy. So we're waiting for Dr. Catherine Sylvester, and I see her here. Or I thought I did. Where'd she go? Let's see if I can remember how to. It's been a while, so there we go. You guys are doing well. I hope everyone is finding themselves well this week. I sound a little hoarse because I also coach volleyball, so this is what you get when you coach and you're a clinician, and my voice is gone. And it's spring in Georgia with all the pollen. Hey, beautiful.
I'm doing
How
great.
are you? Y'all, every time I see her, y'all, she is like, she is just as beautiful a person as she is.
Thank
Like,
you. So
she
are
is
you.
gorgeous.
I had to
I
come
love
with
her.
my A game because I knew who I'd be talking to today.
Oh my God, I
Thank
love you. You are awesome. Y'all, help me welcome Dr. Catherine Sylvester. She is the founder of Operation Mist, and we're talking today about monitoring during pregnancy. I know when people hear monitoring during pregnancy, they start to think of restrictions, they start to think of lack of control. But tell me a little bit about, first of all, let's introduce you. Let's have you tell the people who you are so they can get to know this amazing soul. And then tell us a little bit about Operation Miss and,
Thank you.
the
So,
impetus for that.
Catherine Sylvester, I'm a physical therapist and have been for 13 years. The first part of my career was spent in acute care, where I work with patients with spinal cord injury, stroke, brain injury, work with children. And along my journey, I had a little baby. And from then, it really showed me how much is lacking in maternal health care because I was prepared in the way that I ate, moved, rested, recovered, but realized that other women were not. So that was baby number one. But when baby number two came, I ran into some complications, postpartum preeclampsia, and realized that there was more surveillance that we could be doing as physical therapists. And I didn't have that during my journey, but I did have it during my recovery because I was able to wear a watch and really see that, wow, I'm walking a tenth of a mile and my stress is through the roof, where I'm eating cucumbers, tomatoes, things that we consider healthy. But at that time, we're just overtaxing my kidneys because of the damage that had taken place due to the preeclampsia. And so that got me further into women's health, maternal health. But I also teach a course to students to teach them how to comprehensively treat moms. I'm actually starting up a course for how to use wearable data to save lives. So not that everyone has to be connected to us, but just understanding that you can monitor your own vitals with your smart device and just be more aware of what's going on in your own body. And then I also do guest lecturing. And so I go to universities and do pelvic floor dissections and, talk with them about women's health. But really, I'm just, supporting women remotely right now, birth givers remotely right now through Operation Mist. So you asked what Operation Mist is. And I love how you said the monitoring. Believe it or not, we're doing some work in a rural area. And what I realized was turning them off was that in the flyers, it said monitoring, remote monitoring. They're like, I don't want to be monitored. But when they realize that all we're doing is helping people use a smart device to look at things like how well their body is using oxygen or how much is available to their body, how high their heart rate is getting throughout the day, how high their stress is getting throughout the day, what is the quality of their sleep, not just how long are they sleeping. And so they're able to see that. And for us, as soon as a person opens up their app, their data goes to like a cloud. And then it comes to the provider's screen, like computer screen. So we're able to establish their baseline and then compare their change to themselves. I think the problem with the healthcare system as it is that people are being compared to standards and then treated based on protocols. And so if you have someone who's looking at your health status, your health data 24/7 and can reach out and say, hey, your stress is up today. Has anything changed? And they might say, oh, yeah, some girlfriends came into town last night. We ate terribly. then they look and they're like, wow, this is what my data does when I eat terribly. Maybe I'll do that every once in a while, but I won't do it every day. And so it really is about empowering people to look at their data, make better health decisions, because who doesn't want to show up to pregnancy healthy, show up to delivery healthy, recover well following delivery? And if you can do that, and someone just be there to reach out and kind of give you a nudge in the right direction sometimes, or say, wow, your sleep quality was through the roof. What did you do differently yesterday? And then they say, oh, I actually remember now. I hydrated well. This is what I ate. So they can reflect and make better decisions. So it's really a self-monitoring program. We just kind of help guide the process.
I though, because, and like you said, people get so, especially now because of the way our healthcare system is, right? Here monitoring, and people are like, oh no, I'm going to be restricted. Oh no, this is going to happen. Oh no, it's going to end badly. And I love what you guys are doing, because you're utilizing something that realistically a lot of people already have. They have devices, they have cell phones. Many people have smartwatches or Fitbits or Garmin's, something like that. And even if, and I just discovered this from somebody the other day, they were like, you just go to like the Goodwill and get them. You can go, I mean, like you can get these things you don't have to buy the latest model that hundreds of dollars. You can literally go and get even secondhand devices if you don't have one that do the same thing, just to monitor your health and see where you are. So I want to kind of jump in and talk a little about, you mentioned you had preeclampsia, and oftentimes during pregnancy, because a lot of people, you know, they go to the doctor and the doctor says, your blood pressure is up. There's no context. There's nothing. They haven't told you if you had proteins in the urine. Most people don't even know why they're peeing in a cup every time they go to have an appointment, right? They don't understand the context. And oftentimes there are individuals who have no signs, no symptoms, right? And so what can these devices do to help better track things like preeclampsia, HELLP syndrome, things like that, that can then help to provide for and care for these women to prevent, you know, negative birth experiences,
I am so
stillbirth,
happy
things
you
like that?
asked that, Dr. Martin, because gosh, what it does is it helps a woman understand that her body, it does not just change for no reason. So typically we're in a routine.
Mm-hmm.
And so if we break routine, we expect data to change. But if we don't break routine and data changes, then that's worth investigation. And so specific to preeclampsia, there was a woman who came on monitor, and she had been on monitor for maybe like 2 weeks. And at that point, she was given an exercise program. Now, we do extensive interviews of everyone before they come on, right? And so about an hour, hour and a half, kind of getting to know where they are, you know, their health, like what they do in their day in, day out. And that way, if we notice what stress goes up on the weekends and they say, well, I typically hang out with my sisters on the weekends, then we're not alarmed, right? So anyway, this woman told us in no uncertain terms, she did not exercise, did not have any interest in exercising. Like that was just her life, right? So one day we see intensity minutes spike, and on the watch, that means that her heart rate has been up for a significant amount of time. So that was a definite, like, let's reach out and see what's going on. Reached out, and not only had her heart rate increased, but I'm sorry, had her heart rate increased in that capacity, but her stress also went down. Now, during pregnancy, we expect that stress is going to go up over the course of the pregnancy. It depends on the health status of the woman. So it could be that it goes up 5 points or 10 points, but if, you know, it's supposed to go up, and then resting heart rate typically goes up. And so for her, she spiked the intensity minutes, meaning that she either exercised or something else caused her heart rate to go up. Sometimes it's anxiety. And so, but her resting heart rate went down and her stress went down. And at that point, it was like, okay, let's just see what's happening. So gave her a call and just asked her a few questions. Hey, how's your blood pressure looking? And she was like, oh, it's been up a little bit. I called my doctor's office several times and they said, don't worry about it. You have an appointment on Friday. So just come on in, kick up your feet. By the way, she works full time. So kicking up her feet was really not an option. And her job was like an hour away. She's working 8-9 hours a day and then an hour coming back home. So even if you thought, let's wait till Friday, that's 4 days. That was Tuesday. That's an additional couple of days of her working, right? So anyway, blood pressure was up. So I said, how's your swelling? She said, all of the sudden, it just got out of control. Like, I feel like I'm walking around with elephant legs. I said, well, how about your urine? Do you have any foam in your urine? She was like, as a matter of fact, now that you say that, I said, I do have foam in my urine. I said, listen, I understand that they want you to wait until Friday, but the worst thing that can happen is that you go into a med stop or an ER and they send you back home. At least we'll all have a peace of mind that everything is okay. She went there and immediately they admitted her for preeclampsia. And so the data just allows us to advocate for ourselves. And it's not just during pregnancy, right? I started monitoring myself following delivery. Perry started looking at my data following delivery. And it was 3 days after delivery that we had a mom that we had to send back to the hospital. And her heart rate just would not come down. And as PTs, right, we're aware that after you deliver a baby, your heart rate should be low. Like, you should be chill. You're like, there is no way you should be getting up to 160 beats per minute. What are you doing? We're not exercising 3 days after delivery, right? We're way too tired. And so for her, she was really resistant to going in. She's like, I do not want to be separated from my baby. And I told her, you understand that if anybody understands that, it is me. I would never ask you to go if it wasn't important. And I'm telling you, with 3 days of your heart rate being this high, it's not sustainable. So she did make the decision to go in, went to a med stop. They did an EKG on her, sent her to the hospital immediately. They did an echo. Cardiologist was brought on board. He was like, there was so much fluid around her lungs and her heart that she had 3 weeks. He was like, I would have given her 3 weeks to continue living. And so it's a matter of just, when we have no one else watching us, we have someone watching us. You know what I mean? And sometimes I do think that accountability, because for her, she would have just stayed home. Like, oh, okay, I know it's going to come down. I'll just rest. But that doesn't always happen. And so if you have something like telling you, no, this is not getting better objectively, then in that case, because what I told her, if you listen to the podcast, she's like, Catherine's about to come fight me. What I told her was, you didn't survive this pregnancy to die because you won't go back to the hospital. Let's just see what's going on. And now she's doing great. Had her baby just turned 1 in March, and she's doing great. Her heart is fine, but that's not everybody's story. I just met last night with a young girl who's 24 and has an LVAD. She has a left ventricular assistive device, a bridge to a heart transplant, because 3 months following delivery, she was calling, for 3 months, saying something's different, something's wrong. I'm not feeling good. I'm really tired. And of course, her doctor's response was, you're fine. You're just postpartum. You're tired. You have a baby. Give yourself some grace. That's not what it is all the time. And so here she is in heart failure. By the time someone looked into it and took her seriously, her ejection fraction was 15%. And so we have got to utilize the equipment that we have to identify issues and then fight for ourselves. If someone says, no, I'm not going to look into this, that's fine. We go on to another hospital. We go to another doctor. We go to another med stop, because we have the data that can tell us, yes, something is wrong. Our gut should be enough. People should say, wow, she feels like something is off. Let's just do some tests. Because it's not hard to detect heart failure. It's not hard, like you said, to detect preeclampsia. Not hard to look into HELLP syndrome or any of the other things that women are dealing with.
Not hard to just take a look.
Not. So that's what this does. It makes people take a look and it holds them accountable. We have made, and what I love, because this is with the doulas, there are postpartum doulas who reach out to me and they're like, look, this mom went through hemorrhage. This mom had postpartum preeclampsia. This mom, can you monitor her now? I know that our time is done. We're going to always, you know how it is with doulas. We can always be in touch with moms, right? So that's not the issue. The issue is we can't always be physically present with them. So if they can have someone who's monitoring and then reach out to the doula and say, hey, could you check on her today? Her stress really is high. She got 2 hours of sleep the last 3 nights in a row. Can you reach out? And so they do. It's a team effort, and it helps more people on the team to have objective data to make decisions based off of.
I absolutely love this. And if you are a doula and you're on here, or you're a doula who is listening to this replay, please, please, please reach out to Dr. Sylvester. We'll have all her information at the end of this live, but definitely reach out to her, because one of the things that you have to understand, and she said it so perfectly, we do not function by ourselves. Like, we are not the end all be all. I mean, I'm a pelvic floor therapist and a doula, but I am not a one-stop shop. I am not the end all be all. This really does take a team approach. And the whole concept of it does take a village is so true. And we really, really need to have people rally around moms to give them that support. Unfortunately, as Black women, we we're celebrating Black Maternal Health Week for a reason, because our voices typically are not heard. We need more of these messages. We need more of these stories to get out so that people take Black women seriously. They take women seriously. They understand that when a woman comes in and says something is not right, like that should be enough. Like you said, that's it. Not right. Some is not right. I don't have to explain myself to you. Check it out. Worst comes to worst, you send me home. But if something is not right, then I need you to attend to it. And so I love Operation Miss, because not only can we monitor during pregnancy, but we can monitor after pregnancy. So outside of preeclampsia, what are some of the other things that you typically tend to see?
So I
with the
want to tell you too
monitoring?
something about preconception, but we'll talk about that later in terms of like being able to detect a pregnancy and detect pregnancy loss, which, you know, unfortunately happens sometimes, but can be made. Someone said the first time it happened, honestly, Dr. Martin, I cried when I was watching the data. And, you know, you see the stress going up and you're like, hey, this is, you know, conception or implantation, whatever. And then you see the data go down, you see the stress go down. And it was the first time that I paused in reaching out to a mom, right? But she reached out to me and she said, Catherine, I noticed a change in my stress. And I know what you said about stress and pregnancy. And she said, is there anything you want to tell me? And I was like, you know, is there anything you want me to tell you, or do you want to wait? You know, and she said, hearing it from you, experiencing with you, because we're family now, right? Feels better than me going into a doctor's office and him telling me. And so it was so eye-opening for me, because at that point I was like, okay, I'm not monitoring preconception anymore. I think it's a good idea for people to be ready. But if they're going through fertility and things like that, like I can't deal with this, you know? But I realized that they don't want to deal with it alone. It was selfish of me to even think, you know, we can't do this, but just to watch it happen is difficult. But what she said to me was so eye-opening. And I said, you know, I can't walk away from this part of what we do, because now we can help people prepare for it, right? And then on the other hand, when people get that negative pregnancy test, or they're like, I really feel like I'm pregnant, I'm really hoping I'm pregnant, and then being able to show them, well, look, you know, what it doesn't show that you are. And so we can just, I'm not sure that you are, but just take another test. You know what I mean? So it's not that big of a letdown if somebody kind of guides you through the process. You have somebody to walk with. But some of the other things that we've discovered, anemia, low vitamin B levels, vitamin D levels, um, gosh, so many things. Iron, anxiety. So people who are having mental health issues that are showing up physically, we've been able to discover that. It's just in so many things now that you're asking, I can't remember all of them, but those are a lot of the things. And what happens is, it's not that we're like, oh, that's low vitamin D. It's, oh, she's not charged for like 10 days. That's abnormal. So maybe let's draw labs and see what's going on. And most commonly we see low vitamin D, low vitamin B, low iron, low hemoglobin levels. And so if we just get those checks, and then they do the change, right? And then, or they take the vitamin, or, you know, whatever, then we see their data turn around. And that's the other thing that I love. Like, we had a lady, she had a cyst removed. So if you have or she had a cyst drained. And so her stress was kind of high. She had her cyst drained. So what we would expect is that her stress would go down. So we didn't see that. Within 3 or 4 days, her stress actually spiked. And so we reached out, and she was like, yeah, I'm scheduled to have the cyst removed Friday. And so I said, well, let's just call in, let them know that your heart rate has gone up, your stress levels have gone up, you know, these things have happened. Can they take a look? So she went in, they checked. It turned out that she got an infection following the cyst drainage. So can you imagine having a cyst drained, having an infection, then going under for surgery? Like, that's not a good position to be in. And so what they did was they gave her antibiotics and then pushed her surgery out a couple of weeks. Once the infection cleared, then she was able to have it. So we've seen that. We've also had a woman where she was put on an antidepressant. And of course, some people need to stay on their medications during their pregnancies, and their doctors will make that recommendation. And she was not on it, but she went to the ER because of anxiety. And someone just made the off flippant comment, you know, you just need to take a Xanax or something, like whatever they say, you need to take a Valium. That's what he said. And so she reflexively went back to the medication that she was on, took it, but didn't tell us anything. Ended up seeing her data drastically change. Reached out to her. She told us what she did. And I was like, look, go to your OB, talk to them about what you did. See if there is any other type of medication they can put you on, because this one, your body is not responding well to it. Doctor was very like open to putting her on something different. But between when she was scheduled and when she actually went, watching her data and being able to control it helped her to actually not have to go on antidepressants for the rest of her pregnancy. She felt that in control of what was going on. And so just medication impacts, we've been able to detect UTIs. So we had a lady who went home following delivery. It was probably about 12 days out, and her stress went up. All the markers that something is going on turned out that it was a UTI. So I've been able to detect that. Pregnancies. So we've seen people get pregnant. I had the exact opposite thing. It was so sweet. A mom reached out and she said, I knew you were going to reach out to me. I said, you did? She was like, yeah. She said, do you have something to tell me? This is what moms always, because they think I want to tell them, right? And I said, do you have something to tell me? And she said, I think I'm pregnant. I said, I think you're pregnant too. Because we don't want to like take away the joy of the surprise, right? So sometimes, because there is a distinct pattern for pregnancy versus like stress, we can see the spike for conception. We can see the spike for implantation. There are a couple, the days apart that we expect for it to be. And so I don't reach out at all. And they know me because they know if something changes, or like Jessica sees some change, Amber sees some change, we're reaching out. So when we don't, they're like, you have something to tell me, don't you? It's so sweet.
That is
Thank
awesome.
you.
That is awesome. I absolutely love this. My battery would try to send me a warning. At this point in time, I'm like, Lord,
oh,
the
no, it's not, which is why we do weekly surveys. I love that you said that. We have surveys that moms fill out so that we can know what's going on, because technology doesn't know it all. And so we can be more involved in their process because we actually have the full picture, right? So it's not just the initial interview, but it's the education along the way. We need to be educated so that we can advocate for ourselves. I think it begins with knowing your body, but it also, you also have to know, which is why I got a VBAC doula certification, because I noticed that a lot of women who were getting pushback were being convinced to have C-section deliveries after a initial C-section delivery, simply because they had a C-section in the past. So I started thinking, there's a gap in my knowledge somewhere. I need to fill that gap. And so I ended up going through this training, and it was one of the best decisions I've ever made. Women need to know their options, and they need to have the confidence to stand up for themselves. And a lot of times we won't stand up for ourselves if we don't know, or if we are looked down upon. And so our teen moms, the only time people even know that I do doula work is when they see me in the teen mom community, because they need people to advocate for them, to support them. And so it is such a privilege, I think, to just be able to empower women with the knowledge. And if nothing else, because sometimes people reach out and it's not a good fit, honestly. There are some people who really do have anxiety around knowing too much. And so of all the interviews that we've done over the last year and a half, conversations we've had, just to determine is somebody a good fit, people who are like really high anxiety and like having all of this feedback is scary to them, then it's possible that they're not the right person for it, right? But many people go through pregnancy healthy without monitoring. It's just that they have to know who they need on their team, which is why we are very big about making relationships. They have to know where the resources are. So if your boss says, yeah, you're 8 months pregnant, you can go out on maternity leave if you have a computer screen and a printer at home. Okay, well, if they don't have that, then they've been given the equity, right? They've been given what they think is equality, but there is no equity because they can't get the stuff they need to actually stay home for that month. And so just figuring out what resources exist and making sure that we bring that to the mom, that's so important to us. And then monthly we do education where other providers come in. Because like you said, we don't know it all. I don't want to be the one-stop shop. What I want is for women to feel the love from a lot of different people. Because I truly believe that the solution to this crisis, it is a lot of things. But if women create a team of people who love them and who will pause to look at them, then a lot of things would be caught, right? And so that's how I feel. And so if I can be a part of creating that team, that's what matters to me.
think that is so important. I think that is so important. I can't tell you, even from my patients, from the people whose births I've supported. I've had patients who I've not even been their doula, but they picked up the phone and called me at 11 o'clock at night because I just had a mom who had a baby last week, and I was away for a conference. And at one point in time had no cell service. So then, you know, I get reception. All of a sudden I'm like, why is my phone blowing up? Like, this is weird. It's a Sunday night. And I check in, and she was one of the people. So I check in with her to see what's going on. And she was panicking and she was anxious. And the first thing I did was I sent her some, you know, scriptural affirmations, and we talked. And I was like, I first need you to be calm. And now here's what's happening. But you're okay. She had a boy within a couple of hours. And what she said to me, she was like, thank you for being there with me. You know, and that means so much, because, you know, they don't have to call on you, but to know that you have the capacity. And I wasn't physically there, but to be able to support women in that way
really
is a blessing.
Yeah.
Blessing. Which leads me now to pelvic floor physical therapy. So we're both pelvic floor therapists, right? Whoop, whoop. We're both pelvic floor PTs. We see women, I mean, I see from kids all the way up through postmenopause, and but definitely preconception, pregnancy, and postpartum. And a lot of the times, even outside of just monitoring, like you made such salient points, like just to have somebody lay eyes, because sometimes people don't have the tools or the skills to advocate for themselves. While we recommend everybody have a doula, not everybody might have a doula. And so tell us a little bit about, I'm gonna let you plug it because they might say I'm biased. So why do we need to have a pelvic floor therapist?
My goodness, there's so many reasons. Number one, I think that women need to understand their bodies. So we explain it very well, what's in each layer, what the job is, how the body is going to change throughout pregnancy. And so some of what I love to do is helping women modify what they do throughout their pregnancy. So sometimes you'll hear people just say, well, I'm just going to do the same thing I did pre-pregnancy the first 3 months. Someone has told them that that's what they're supposed to do, right? And so what if a subchorionic bleed comes up? Or what if she's at a higher risk for having miscarriage for some reason, or she has fibroids? Is it appropriate for her to have run pre-pregnancy, and then now she's running the first 3 months of her pregnancy, right? The PT can help give more clarity, give more information so she can make better decisions. But then over the course of the pregnancy, if things come up, they won't be surprised if you've already explained to them, look, this is what relaxin is going to do to your ligaments, to your bones. This is what, this is what's going to happen with your heart rate. And so if you get tired toward the end of your pregnancy, these are some things that you can do to modify your work environment, your home environment, your responsibilities. So just helping them modify their lives. So for me, I'm always like, can we check in first trimester, second trimester, third trimester? And then, you can call on me anytime. And that way we know the changes that are taking place, because sometimes when women are told, well, you're just going to be out of breath, it's not just that you're out of breath, it's that your diaphragm is displaced a little bit, right? So now it's supposed to be expanding down and there's this baby that's there. And so it's like, you can help explain so that they know what's normal, what's not normal, and then what's normal for them. Because if we know them at the beginning of their pregnancy, then we can know if things change along the way. The other thing, though, that I have noticed, and just in talking to some women and working with some women, is that when they go to give birth, if no one's taught them how to relax their pelvic floor, then people are like, baby's stuck, baby's stuck. Baby's not stuck, pelvic floor is tight, right? So...
my all the time. You want to know if somebody's got a real tight pelvic floor? You see those babies that come out that look like they got a head, that their head is long for days. And I know that it will go back to the nice spherical shape. But when your baby has come out and their head, you know your pelvic floor was tight, because if that pelvic floor was relaxed,
yes, right, but I'm like, so we have to be able to assess and see what can we do to help the baby get through the passageway better, right? And I just think, in terms of vaginal massage and the breathing, not just to sometimes when we get to see them during pregnancy, we notice how they use the bathroom. So when I'm at people's houses, seeing them in their house, you hear them straining in the bathroom. You're like, wait a minute. What's happening, right? You've not learned that the best way to move things through smooth muscle is to breathe, just to relax, right? And so I think that if people get the concept that the uterus is a smooth muscle, you cannot control it, right? But what you can do is facilitate what it's supposed to do, whether it's through changing positions, because that's another thing we are good for, is helping them come up with the best positions for labor and delivery, helps to explain to them how not to tear. One of the teen girls, I just have to say this, she did not care anything about any of the education that we were given, right? Except when I talked about not tearing, right? So I'm just like, if you're in a good position, she's like, wait a minute, I can have a baby and not tear? All of a sudden, she was all the way bought in to not only having a natural delivery, she was all the way bought in. We can help with those position changes. The other thing is sleep quality. Toward the end of pregnancy, we know sleep quality is going to be impacted, right? But we can help with improving positions so that women can actually get a good night of sleep. And what I love is that, in this role with remote monitoring, I don't like to blur the lines a lot. In terms of what I do. So I'm often referring to other pelvic health PTs, but I do a lot of FaceTimes with moms. And so it could be in the hospital when they're there trying to use the bathroom. People are telling them, you got to do this. They have no binder on. They're not taught any massage techniques. They're just told, you got to use the bathroom. And so as PTs, we can help let them know, how do you get your bowels to move when it doesn't want to move, right? And then if you have a vaginal tear, so let's say now we're post-delivery, you maybe have a vaginal tear, you have a C-section delivery, how do you move that fluid to help your body do what it has to do without overloading your kidneys, without overloading your heart? How do you move and do it in a way that's safe, but you're not being so still that you get a blood clot, but you're not moving so much that that you're not recovering well? We can help them find that balance. And then we can also, because I feel like, how I feel about following delivery, waiting that 6 weeks, 8 weeks, whatever, that is way too long. What'd you say?
I see them at 2. I see my mamas 2. The latest is 3 weeks. I am in there.
Yes.
I'm looking at movement. I'm looking at your house. I'm looking at where baby is. I'm looking at all of those things. I think a lot of people have the misconception that as pelvic floor PTs, all we do is stick fingers in vaginas, right? That's not it. We comprehensively look at women. We comprehensively look to see what is going on. The body is all connected. And people can't move, can't breathe, can't function. We need to address that, because we're going to start compensating. And that's sometimes what leads to some of the things that people hear about: the prolapse, the worsening of a diastasis, the pain, all these things. And so, we definitely need to be in there a lot earlier. I do agree. And I've had great success with my clients being in there 2 weeks. They're like,
yes,
you need to see me when you get
you
home.
and me
Okay.
both. We typically schedule for 5 days post-delivery. And so I just go in, but it's like you said, I'm watching. How is she walking? How is she getting up out of the chair? You'd be surprised how many women with a C-section are pushing their stomach forward to get up out the chair. It's the little things that we can help them do that prevent. Because when I started doing the program with moms, the program is called Rediscover Your Music, where we look at their muscle flexibility, urinary and fecal incontinence, ability to, control that, sexual fulfillment, internal confidence, core stability. It was like, a lot of this could have been prevented. So how soon do we need to be a part of the team? And in my opinion, it is ongoing. It's like you should have a PT that you can reach out to and be like, hey, this is what's going on, or hey, I'm about to have a baby, or I was thinking about having a hysterectomy, because everybody sends them to me with the hysterectomy pre-consult. Most of the time they go back and they don't have that hysterectomy, because you understand there are so many things that you can do to impact how your body feels during your monthly cycle, when you're transitioning perimenopause wise. We don't have to resort to birth control and surgery, right? That should never be the first option for anybody. And I think as PTs, if we can just explain the fertility cycle, we can explain the hormonal changes and things that are taking place. I think that we would pause, right? We're talking about providers pausing. We as women need to pause and say, is this a season of life, or is this a permanent state? And you can make a decision, a better decision, if you realize that for women, most of the time, it's just a season. And if we can look at the way we're hydrating, sleeping, you know, the foods we're putting into our bodies, the amount of stress that we allow ourselves to be exposed to, then we can change the experience. And you know, I am biased to PTs, like you said, too, but we do holistically treat. And we're able to speak to different areas and then refer when we realize that it's needed. And so some of the things that you talked about, though, that women do worry about, the diastasis, the prolapse, like those are things that we can help with too on the back end. But I'm like, why not prevent that on the front end, right? I really just don't like being on the other side of things. I want them to be able to prevent, but also to be able to identify. So yes, some women will prolapse, some will tear, some will have C-sections. Can we help them then heal the best from that situation? And the answer is yes.
Absolutely. One of my favorites even is scar tissue. I had a mom that, and her scar was pretty much involuted. It was, you know, she had a hypertrophic scar. It was so tight, it was pulling the skin inward. And she had two of them because she had a C-section, but she also had an appendectomy. And she'd always had so much pain. And I mean, before even our third visit, by our second visit, there was a drastic change in the way that she was able to move, in the way that she felt. By the third session, she was like, why did I not know about this sooner? And it's little things like that. And unfortunately, you know, you don't know what you don't know, but there's so much that goes into, you know, what can be done to help women. And as we think about looking holistically, because I'm with you, right? Like the first option should never be, let's cut them, you know, let's look holistically. And as I like to tell my clients, I'm like, I always go for the low hanging fruit, right? What are the things that we have the capacity to make immediate changes to? Like you said, your hydration, your nutrition, your sleep, your stress level, more often than not, those types of things. And you can start to see changes even there. And it's so amazing. But, you know, it starts with education. It starts with helping people to understand, you know, what we do and the benefit and the impact. I saw somebody as you know, the information was scrolling up, somebody asked about polycystic ovarian syndrome. And, you know, I see a lot of people with that, but I see a lot of people with that as an integrative wellness coach. And, you know, we think about things like nutrition. We think about all the other things. I help people to understand their menstrual cycle. It's amazing that a lot of people don't know. You know, it's amazing that in our society as women, that is not something that is deemed important. Like, I mean, most people are trying to stop it. Most people are trying to get rid of it. Amazing thing, y'all. It's thing. And if you understood the menstrual cycle and you understood the phases and you understood what is happening in your body at those times, you have a wealth of information about you. And this is not to compare you with anyone else. You now have a wealth of information about you that you can utilize, you know, in a medical appointment and all types of sorts.
I love this. Okay, so you know we have something going on called a More Than a Period party. So we are so excited about it. Just today the thermometers came in. But the youngest person who's registered is 11 years old. The oldest is at this point 35. And of everyone that we've sent the educational materials to, just to kind of have as we resort to them or refer to them during the party, they're like, I can't believe what I didn't know about my body. And I just think if we had more information to provide to our providers, because sometimes people are like, well, doctors are just doing random things. They're just treating me like everybody else because they have the same information about you as they do everybody else. But if you come to them with more information, like, okay, my favorite. So we had a mom and her progesterone levels were not high enough following her pregnancy to sustain a pregnancy in previous pregnancies. They didn't know that was the problem, but it turns out that was the problem. Well, if you're tracking your temperature and you see that all month your temperature is low, and you tracking your stress and you see that all month your stress is low, that is a clue that, okay, estrogen is abounding, right? So yeah, you can probably get pregnant once it hits that tipping point for the luteinizing hormone to help it out and ovulate. But then can you sustain that pregnancy? How long is your luteal phase? You don't have to spend $25,000 for a fertility doctor to tell you that you need some progesterone, right? They don't have to do all these testing. You don't have to take all the injections if you can go to them with more information. So people think sometimes, well, healthcare is a money grab. Well, that argument will always be on the table, right? But at the end of the day, they don't have to grab your money. You can come with your information and you can say, look, all month, my temperature is 97.5. So what I'm thinking is that maybe because it's not going up after I ovulate, that my progesterone levels are low. Would you mind checking those for me? You know how much cheaper that is than them doing a whole bunch of stuff to you? And so we've had women who, someone brought up PCOS. The lady who just recently delivered, I cannot wait to do her conversation. She was told, you have PCOS, you're not going to get pregnant, blah, blah, blah. She between pregnancies lost 30 pounds, changed the way she was eating, moved more toward a plant-based diet, started tracking her stress. Now her average stress went from being 40s to like 20s. Her husband moved her closer to the OBGYN because he realized that it was the best place for her to be, but the drive was causing her stress. Like, she got pregnant, thrived throughout her pregnancy, had her vaginal birth after cesarean, but it's because she prepared her body. And so when we see those diagnoses, it's like, okay, that might be the symptom. Let's talk about the root, right? Let's talk about what you need to know. Because at the end of the day, when I hear people and they're like, oh God, they're saying I only ovulate 3 times a year. That's 3 times a year that you can get pregnant. So let's capitalize on those 3 times instead of worrying about that as being a barrier. If they say that the average person, it takes a year before they say that you're infertile or whatever, then just know that, hey, if you only ovulate 3 times and multiply that by 4, it may take you 40 years, right? Hopefully it won't, because you'll be more aware of what's going on, of what is fertile fluid, what is not, like how your body feels when you're fertile, right? Not just what you're looking for, but how do you feel? Are you like a rabbit or are you like a recluse? You know, that'll help you know what's going on the inside. And so we're having these parties and we're just going to keep going. Right now it's on a grant with Healthy Mothers, Healthy Babies of Georgia, and they've sponsored it. In addition to like Quilted Health, they started just looking and they were like, yes, we can help. Everybody's talking about the Roe v. Wade overturn and stuff like that and how it's going to, you know, take options away from women. Why don't we give them the option on the front end? Then they don't show up to pregnancy, to an unexpected pregnancy, right? So we're more about how upstream can we get of the problem so that we're not stuck.
Days of the month can you actually get pregnant?
Right.
Like this many. Don't go taking Plan B when you're not even possibly gonna get pregnant. Yeah. So, and these things you know when you know you're gonna be. It's amazing.
Me too.
I love it. Well, you're doing a lot of stuff. We've got Operation Miss. Tell us a little bit more about how people can get involved. How, you know, I know there are tons of doulas who are listening to this and will listen to the replay. How can they?
So we have an interest form on our website. So www.operationmiss.org, and our phone numbers are on there as well, so they can reach out in that way. But essentially, there is a link that you can click, and then if someone just wants to talk or schedule a conversation, because we love to, you know, just get to know people, of course. Then there is a calendar on the website as well. And so that's the best way. I also, if you are looking at, you know, I love scars. I know we talked a little bit about it, but my other Instagram is From Scars to Beauty Marks. So if they just want to refer people to information, then there is information on there as well. I would say that those are probably the best ways to get in contact.
Nice. And tell us a little bit more about
okay. So what we're going to be doing is we're going to start out. Wait, what'd you say? Okay, because we just like, you know how like when things start coming in the mail, you're like, okay, it's really happening, right? So we're going to start out with food and then a fact or myth game. So like, what is fact, what is myth about our cycles, about, you know, childbirth, delivery, stuff like that. So that's the first part while we eat. And then we have models of the vulva, the cervix, like all the models that we use to teach, but we bought more so that we can kind of get more granular so they can see their reproductive system and have hands on it and stuff like that. So we're super excited about explaining the anatomy of it all, how everything works. And then we're going to go into the 4 phases of our menstrual cycle, but we're actually going to mix cervical fluid. So we'll go through the 4 phases so that people understand, you know, what's happening throughout the month. but then in hormonal changes, things like that. Maybe how to schedule things so that you're not doing things on your when you're tired or whatever, how to prevent issues and just have the best period experience possible, right? Or fertility cycle experience possible. But then we're going to mix cervical fluid. So we're going to be using like aloe vera gel so they're going to cut open the aloe vera so that they can see, well, what does fertile fluid feel like? How slippery is it, right? And then they're also going to make infertile fluid using, just in case people want to do this too, witch hazel and baking soda. We're going to use that. And then for the creamy, kind of more fertile fluid, but not the egg white like consistency, using olive oil and baking soda. So we're going to have all the kids, whoever's there, like mix the fluid so that they can feel it and kind of review what we talked about previously. And then we're going to talk about how our lifestyle choices impact fertility and our experience with our cycles. And so it's just going to be, so that's going to end it off. And then of course we'll have a Q&A and everything, but it's going to be super interactive and we'll have things so that they can remember. My son, this is just random, but he teaches cooking classes to other little kids and to their parents. And he made up a song and it was like, omega-6, omega-6 will make you sick, will make you sick, omega-3, omega-3, it's good for me, it's good for me. So we're coming up with stuff so that we need to demystify what's going on in our bodies. And if we can just come up with little things where women can remember things about their bodies, it'll make it like estrogen, right? So I was thinking estrogen and Eskimos. So you're a little bit cooler when estrogen is being released. That first half, you're like, right, just like people, if we make it easier, then they can know what's going on. So that's what the party's all about. The first one's going to be here in Macon. The second one will be up in Atlanta later on in the year. And we'll just see what went well, what do we want to change. But at the end of the day, our bodies, this amazing design, if we just understood it, we'd be a lot more empowered. Not just because the 11-year-old, you're thinking, okay, she knows now. Can you imagine when she gets to 25 and is trying to get pregnant? You can't tell her nothing. Nothing.
Nothing. And you know, it's funny. Everybody is talking about, well, we need sex ed, but these are the things that we need to teach these kids. These are the things, help them to understand their body, because teach penetration, but if they don't understand context, we are creating a devastating storm. We need to know, they need to know their bodies. They need to understand. I love this so much. I love
so for this one, it's
April
the 15th. For the one in August or toward the end of the year, we don't have that yet. But once we do, I will definitely let you know. And then the other thing, what we've done for stuff that we're not necessarily going to delve deep into in the course, because I felt like in terms of like an audience, when you have that big of an audience, you want to talk about everything that's relevant. But we've created information that was geared toward teens in the first place, or people who are starting their cycles. So they'll also have sheets that are like tips for like clipping your nails, like different things to use to catch the menstrual blood or whatever, or because it's not just blood, but you know, when you're menstruating to catch that stuff. And so we'll have handouts about things like that, birth control, because people are like, well, just tell them not to have sex. Well, why don't you tell them what so do you have a risk of blood clots with abstinence? No, but with, certain types of birth control, yes, you do. Or heart issues or weight gain, or just like, can you put it in a chart and let them make the decision? We all know what we want for our kids, right? But you shoving it down their throat is not the way to go. It is providing them with information. So we have handouts so that regardless of who's there, they can all take it and either give it to their kids or share it with their friends or whatever. So they'll get those at the end as well. Thank you.
I love it. I love it. It was so amazing, as always, to talk to you, to share this information for y'all that are listening. I hope y'all realize why I think she's so awesome now. Okay. Phenomenal. And how old is your son? Because let me tell y'all how awesome she is. How old is your baby?
And they're paying
he's teaching too. Okay. So I how this family is so awesome. Okay. Family is phenomenal. So it has been amazing talking to you. I pray continued blessings on you, on Operation Miss, on all the people that you have helped and all the people that you will help, because you are doing so much good in this world and we need more people like you. So thank you for all that you do. For all of you guys listening, please go onto their Instagram at Operation Miss. You can also go to at From Scars to Beauty Marks. This is Dr. Catherine Sylvester. If you guys need me, I am found at the Pelvic Perspective. All my information is on there as well. But it has been a pleasure being here with you on this beautiful Wednesday for Black Maternal Health Week 2023. Check them out, y'all. www.operationmiss.org.
Yes, because
Any
I
parting
have to
words, Miss
throw flowers
Catherine?
back to you. I feel like when people do this to me, I'm like, oh, it's about you. But really, this part of this conversation is about you because years ago when I met you, I knew that you had something very unique to give to people in general. And it's just like over the years, I've just been able to see your voice magnified and your impact magnified. And so now, in your absence, people are talking about you and the impact that you've had on their lives. And so I am grateful to you, forever grateful, because I feel like without the piece that you bring to the table, women would be left without. And so thank you. Thank you for your podcast. Thank you for your education. Thank you for everything you put on your Instagram, on Facebook, like for sharing your successes with us and your growth with us. Because I think from a woman's perspective, I get to learn from you and your knowledge, but from a business owner's perspective, I get to see what's possible if I just stay the course. And it's not just this is going to be the growth you experience, but this is going to be the impact that you have on women across the world if you just don't stop. And so thank you for being so transparent with your story and so free with your knowledge. And then also for sharing space so that you can help other people magnify their voice. So I really, really appreciate you and just want to take this time to say thank you.
Thank
I love you
you.
too.
Oh my God, I love you. You're awesome. Love you. Thank y'all. Have an amazing rest of your day. And join us again this week. Follow the National Black Doulas Association on Instagram, on Facebook. There are going to be more lives. There's a lot more information and a lot more amazing people doing great things. And I'll be posting some of these things on my Instagram and Facebook as well. But for now, have an
Thank you.
amazing
Thanks,
rest of your week,
everyone.
guys.